Hi, this is Dr. Nick Biasotto, your host to the podcast of the Medical Society of Delaware, Delaware Healthcare Reality. Just to let you know, we have three big events coming up for the Medical Society of Delaware. On October 18th, the Superhero for Hope 5K Health Fair and Food Drive will occur at Rockford Park. Keep that in mind. On October 23rd, as part of MSD's annual meeting week, a virtual CME program with this year's theme, The Body Connected Healthcare Wearables, will occur. And don't miss the 236th annual meeting of the Council session on October 25th with keynote speaker Stephen K. Klosko, MD, MBA, author and former president of Thomas Jefferson University, who will present Swifties, Startups, and the Singularity. For details for all of the three events, go to the MSD website at www.medicalsocietyofdelaware.org. That is, again, www.medicalsocietyofdelaware.org.
Welcome to Delaware Healthcare Reality, a podcast presentation of the Medical Society of Delaware with Dr. Nicholas Biasotto. Dr. Biasotto is board certified in family medicine, and he has extensive experience and training in treating patients with addiction and substance abuse. Now, let's join Dr. Nick Biasotto for Delaware Healthcare Reality.
Hi, this is Dr. Nick Biasotto. I'm the host of the Medical Society's podcast, Delaware Healthcare Reality. Today we have a guest, Dr. Jeffrey Meyers, who I will introduce shortly, regarding psychedelics in medicine. But I would like to give a brief introduction before we introduce Dr. Meyers. Psychedelic drugs have a rich and complex history, spanning ancient rituals to modern therapeutic applications. These chemicals have been utilized for thousands of years across various cultures. The oldest evidence of their use dates back to the caveman, in which you see a man depicting eating mushrooms and then having some strange thoughts after that. This is some 9,000-year-old evidence. Psilocybin is the active ingredient in these mushrooms, and the Aztec Indians used this in their religious ceremonies. And peyote, a cactus containing mescaline, has been used by Native Americans for spiritual and healing purposes over 5,000 years. But back in the 50s and 60s, psychedelics gained popularity in psychiatric research, with studies exploring their use in conditions such as alcoholism and depression. A psychiatrist, Humphrey Osmond, started to prescribe LSD, lysergic diethylamide, believing it could produce profound psychological changes to the betterment of patients' particular psychological problems. But then in the 60s, you've heard of Dr. Timothy Leary, who said, tune in, turn on, drop out. And it began to be widely used recreationally, leading to concerns about safety and abuse. This prompted the U.S. government to impose strict regulations halting research and criminalizing their use, placing these chemicals into the Schedule I category, limiting usage and research. However, recent interest has led to a significant resurgence in the approved research and abundance of data supporting their medical benefits in the treatment of depression and particularly PTSD. I'd like to list the psychedelics. Psilocybin is being used in some research centers for depression, PTSD, anxiety, alcohol and tobacco use disorders, LSD for anxiety, depression, and cluster headaches, as well as abuse disorders, mescaline and peyote for depression, addiction, and PTSD, MDMA, ecstasy, for PTSD, anxiety, and couples therapy, ketamine, chronic pain, depression, suicidal ideation, ibogaine for opioid addiction, and 5-MeO-DMT from toad venom for depression, anxiety, and addiction. So before I introduce our guest, and we have a lot to talk about, I'd like to take a quick break, and we'll be back in a minute.
Information about the Medical Society of Delaware can be found on our website, medicalsocietyofdelaware.org. Questions about our podcast can be emailed to healthcare.reality@medsocdel.org. That's medsocdel.org. Once again, here's Dr. Nick Biasotto.
Welcome back. Our topic today is psychedelics in medicine, and we have our special guest, Dr. Jeff Meyers, who's been doing this for quite some time, researching the benefits and possible detriments of psychedelic medicine. Dr. Meyers received his BA from the University of Pennsylvania. He received his MD from the University of Colorado School of Medicine in Denver. He has an internal medicine residency he completed at the University of Pennsylvania from 1993 to 1996. He has a physical medicine residency program from the University of Pennsylvania Medical Center. He is certified in acupuncture from the UCLA campus in California. He is a certified therapeutic massage. He also talks about that and does things in that regard. He's certified in psychedelic-assisted therapies and research from the California Institute of Integral Studies. He is presently an attending physician at Rehabilitation Associates, Delaware Back Pain and Sports Rehab Centers in Wilmington, Delaware. His hospital affiliations are Christiana Care, St. Francis, University of Pennsylvania, and Thomas Jefferson Hospital. Welcome, Dr. Meyers.
Great to be here, Nick.
Great. I'll call you Jeff. You call me Nick. How's that?
Okay, thanks so much.
All right, very good. My first question is, how did you come about becoming interested in psychedelics and the potential therapeutics that we can see in medicine?
Well, you know, I'm a pain management physician, and we all know just how pain is such a difficult condition to treat for people. It's never just the biology of the pain that gives people problems. You know, it's a bio, psycho, social, even spiritual phenomenon. And so after years and years of treating these patients with some integrative therapies, because, you know, I work with the patients when they come in, you know, from where they're coming from, you know, with their own mindset. And I just realized that, you know, we were still lacking things in the armamentarium. And I had a number of friends who are in the mental health field, and one of them told me about Bill Richards, who's one of the researchers at Johns Hopkins, where there's a lot of psychedelic research activity going on. And so I called up Bill and went and visited him one day to learn a little bit about psychedelic research. And he said, you know, there's a program for physicians out in California at the California Institute of Integral Studies where all the researchers go and give presentations of their up-to-date work. And so I thought this could be another tool in my armamentarium for pain management and all of the biopsychosocial things related to that. And so I went and entered that program and got a certificate.
Very good. Interesting.
Very interesting.
Well, I grew up in the 60s, so I'm very familiar, 60s and early 70s. I'm very familiar with psychedelics as they were everywhere during my college years. I've seen people who've taken them and wondered why, but they seem to have a good time most of the time. So I'm aware of these medications or these chemicals, and I'm unsure of how they work. How do they work in the brain? What pathway do they take to cause the effects that they're getting?
Sure. Well, the traditional psychedelics, like the things that you're talking about, like psilocybin, some people might have heard of ayahuasca, which is a plant medicine, and LSD, of course, like you were mentioning, that they traditionally work on the serotonin pathway. And honestly, even with all this research, they don't know exactly how they're working, but they know that it's a serotonin agonist, okay? And then there are other psychedelics that are the non-traditional psychedelics, one including MDMA, or ecstasy that you were mentioning, and that also works by flooding the serotonin system, but in a different way, okay? And that's called an empathogenic hallucinogen, or an empathogenic psychedelic, because it's known to be quote-unquote heart opening. And this is one of the medicines that used, as we were saying, for post-traumatic stress disorder and treatment-resistant depression, where people can go back and review the incidents, the traumatic incidents that have happened, and be able to go there from a more vulnerable place and relive the experience in a safe way, and through this empathic approach, able to, you know, make great strides in improving their condition. I'm going on a little bit long here, but I just want to make sure everybody understands. Just and also then there are the third categories of psychedelics, which are called the quote-unquote dissociative psychedelics, okay? Because dissociation in the sense that, you know, you lose your sense of self. And ketamine is the main psychedelic that's known in that class. Some people will say ketamine is not a psychedelic. Well, it's true. It's not a traditional psychedelic. But it can cause people to have, hallucinations. It can cause them to have sensory experiences, like the typical psychedelics have. But what it does is it allows people to undergo a dissociation experience where they can break through a pattern of depression or some habit of thinking that they have in their brain and reboot and start from scratch. And that's how ketamine has been shown.
Ketamine was an original anesthetic, right?
That's correct. It depends on the dosages. Ketamine is also used for pain management.
Yes.
For
I've had patients who have sent to someone who did that years ago, and it was for chronic regional pain syndrome, and they had some success with the control of that pain. I'm sorry to interrupt, but go right ahead.
That's great. Yeah, so it's been used for years for complex regional pain syndrome. It's more typically used, as you said, as an anesthetic, but in between the dosages for pain management and for complete anesthesia, you have this dissociative experience where people can, explore these maladaptive mental health states and can often get relief from them. And ketamine works different. It's not so much serotonergic. It works more with the NMDA glutamate system, and it's an antagonist versus the other psychedelics, which are serotonin agonists.
Agonists, correct. Okay. Okay, very good. Now, in the usage of this, how safe are they?
Well, it's interesting because there are a lot of myths about psychedelics being unsafe. And the important thing to know is that the way that these medicines are being researched and used, in the medical field mainly, is through close attention to the set and setting that they are done in. Okay, so if someone is out just taking one of these medicines, for a tripping or something like that, where it's not in a supervised setting, anything can happen because you become very vulnerable. It's typical. And if you're in a setting where it's not safe, then you can have bad experiences. Exactly, because you're you sensory overload or overwhelm from the experience. But when it's done in a safe setting, like is being used in these research studies, and also, which we can talk about later, because it's used in some church settings, especially in South America, where these medicines are used as sacraments, like you were mentioning, the Native American Church and some of these other institutions, where under these supervised settings and organized settings, people can have experiences that are either peak experiences or help them through mental health conditions that have been troubling to them for chronically.
Wow, cool. Now, in my research, I've found that there are certain contraindications to the use of psychosis is one and bipolar disorder is another. Is that true?
That's correct, although there is current research going on. There's been an explosion in research really in the last 8 to 10 years. And now they're researching everything, even looking at things like bipolar. But again, in general, it's contraindicated, but there is research in this area to see if they can be useful for some of these previously contraindicated conditions.
Okay. How does these medications sort of compete with what's out there for these conditions?
Well, there was a huge exuberance about them, which could be considered that phrase, an irrational exuberance. But they look like they're at least as good as most of the current medications that have been out there that are traditional, like SSRIs and things like that. In the beginning, people were saying this is going to be the miracle cure, and some things were saying that 80% of the people who were taking them, in this appropriate supervised setting, were having a positive outcome. I think that as the research continues, we're seeing that there's still a tremendous value to them, where it's somewhere in the 40 to 50% range, and it's closer to what you might see with an SSRI or an SNRI. But also, different people can respond to these medicines than to the traditional or even the older antidepressant medications.
Well, you mentioned that they take the serotonin pathway generally.
Generally, yes.
Does dopamine or norepinephrine, two of the other neurotransmitters that affect psychology, the psychiatric well-being, I guess, do any of these go that pathway, or they inhibit that pathway? What do they do in that regard?
That's correct. So that serotonin pathway, which involves dopaminergic and noradrenergic influences, that more or less the different psychedelics also are affected by those neurotransmitters. It depends on which particular one.
Okay.
But they all have this common serotonergic pathway, except, as I said, for ketamine. And, there's a lot of science behind it. You could go and look at each one's profile, but it's not like they blanket affect norepinephrine or affect dopamine. Some of them have a pathway that's on the opioid pathway. That there's some triggers of the opioid pathway.
That's the pain control part, I guess, right?
It could be. But again, these medicines, even though there's so much hype, even with the cutting-edge science, people are still not completely sure about how they're working, and that's why there's so much research going on. There's a lot of, pharmaceutical research going on to try and find, how can you really hit the sweet spot and treat each specific condition in a way that's effective for it.
Okay. Jeff, do you believe that the feds will change their scheduling regarding these chemicals? As you know, the feds haven't budged on removing THC or marijuana from Schedule 1 yet, though other states, many states have legalized it both medicinally and for recreational usage. Still in Schedule 1. Do you think they're going to move quickly in the direction of these medications, if that comes, to put them in a different schedule so that they can be researched even greater than they are?
Well, to be honest, I don't know, because when I first got into this field, in 2018, we were told that within the next 2 to 3 years that they were going to be rescheduled, and really that the gates were going to open up, and we were going to have a massive improvement in the mental health in the U.S. And as it's happened, over time, the feds have not changed. And in fact, last year, there was MDMA was up for approval through the FDA, and they had been working with the FDA for 15 years in developing their studies side by side, going every 3 months to the FDA to get input, and then did these, stage 3 trials that showed people had improvement from PTSD and treatment-resistant depression, and then last summer they were turned down, even though the FDA had been holding their hand for years with guiding their research.
Why was that? Do you have any idea?
It seems like it was political.
Politics, as usual.
like so many things. And also, the studies could have probably been done a little bit better. But I feel like, I hear, from the courses that I've taken, where they're having people who had come back from traumatic experiences at war, like in the Gulf War and things like that, where these were people who were living on the street, they weren't in relationships, they had, abuse problems, whether it was alcohol or other types of illicit substances, and people who went into the trial, for instance, for MDMA, in the training we would watch, their improvement over the year, what was happening over the year, and a year later, these people were like at work, in a relationship, back in school. It was just incredible. We watched videos of these therapies as people went through and had people come in and talk.
And at that time, they were still using the medication. It's not like a one and done and you're back to normal.
So that's a good question. Really, it depends on which medication. That's one of the important things with psychedelics, is that unlike things like an SSRI for depression, for instance, these medicines, you only need to take them a couple of times, to have a significant improvement that can last long term.
You're talking about the psychedelics.
That's correct.
Okay.
So like with the MDMA ecstasy trials, basically what they were having, people was having one MDMA session a month over 3 months. And prior to the MDMA sessions, they were having psychotherapy and intakes for a month before. During the period, of the trial, over those 3 months, they were also having psychotherapy sessions. And then after the trial, they continued to have psychotherapy for a couple more months. But by the end of a year, they were not in therapy, per se, and they had dramatic improvement. That's also part of what the feds brought up as one of the challenges was to the medicines was it just the psychotherapy that was really causing them to improve? Even though there are many studies about psychotherapy that have shown that on its own, it has only partial effect on the PTSD.
Right.
But these medicines seem to supercharge it over and over and over in multiple studies.
Interesting. Now, do any of these psychedelics interfere with the metabolism of other medications that we take regularly for diabetes, hypertension, etc.? Does it affect the cytochrome P450 system? Do they go that pathway? How are they metabolized?
Well, again, it depends on which particular psychedelic, okay? And so, especially psychedelics, there are some psychedelics in particular, the MDMA, that can affect the MAO system. And so you know that there's a lot of things that can kind of cross over with that. And
so you don't want to give any MAOs while you're taking that, huh?
That's correct.
I hardly use them anymore anyway. Go ahead.
That's true. But there are some very good websites up there, including one called Chacruna, Chacruna. I believe it's .com or .org, where there is like lists that you can see of contraindications of specific psychedelics, that are vetted by, people in the medical field, doctors and pharmacists and things like that that are legitimate, and these are well-known sites that you can go to where you can find information about this.
Got it. What's the data? Do we have evidence-based data enough to show the significant benefit or detriment of these medications? Do you have enough data? Is there enough data? Are they accumulating more? I'm sure. But why is the FDA still digging their heels in?
Well, there's been, as I said, an explosion in the research in the past 15 years or so. Back in the 70s, actually there was a fair amount of research back then. From the 50s to the 70s, there were over 1,000 studies on psychedelics, over 1,000, that showed some benefit, but the studies were not that rigorous. Then since the late 90s and early 2000s, the studies have become much more rigorous. There's another 1,000 studies out there right now. And so there is very good evidence-based, quote-unquote, medicine on treatment-resistant depression, post-traumatic stress disorder, and addiction. And there has been a whole flurry of research, especially in the past 5 years, on everything from chronic pain to, traumatic brain injury and even spinal cord injury, seeing how these different medications may have a positive effect. So what kind of happened was
on the mental, but not necessarily the physical, like the spinal cord injury.
The spinal cord is even looking at the physical because, it seems to be a quality of many of these medications that they can make people's pain go away while they're on them. And so it's like, what is the cause of this? Also that they can cause, neuroregeneration is one of the things that's
really they're showing that.
This is what they're looking at right
Interesting.
now. Okay,
Interesting.
And so, like I said, there's in the last 5 years they've really been looking at so many different areas for potential use. In the beginning, everybody was repeating the same studies that were being approved by the FDA because they didn't want their study to be turned down. But now it's become much more flexible, and there's a lot more diverse research.
Is there any addiction potential to any of these, i.e., is there a withdrawal if you stop or, if you have your dosage and then all of a sudden you don't have it for a month? Is there withdrawal?
No. In general, the answer is no. Okay. There doesn't seem to be any type of physiological addiction that occurs.
Okay.
Ketamine is known that some people develop a psychological addiction to the state that they're in.
Okay.
And so that's something that, for people who are undergoing ketamine therapy, they have to be monitored for. But in general, these medicines, these psychedelics are not addictive.
Got it. I have a couple of patients with PTSD. Haven't had much success with what has been given to them by either myself or a psychiatrist. Excuse me. But how do they, if they listen to this, our audience is mixed, both medical and non-medical. If they listen to this podcast and they say, I need some help, where can they go to join into the research program to utilize these medications to see if they will benefit from it?
Well, as you can imagine, because there's been so much hype, people are flooding the places that are doing research to try and get into a study. But ketamine, as we were talking about, and particular S-ketamine, which is the nasal ketamine, was approved by the FDA for depression. So again, some people say, ketamine is not a traditional psychedelic. It's true, but it has similar effects and is very powerful. And so it can be prescribed, by your doctor. Also in Delaware itself, there are a number of ketamine clinics here, and I'm not pitching any place in particular, but you can investigate and explore. As far as psilocybin is concerned, the quote-unquote magic mushrooms, as you were saying, they have been legalized for medical use in Oregon and in Colorado and in New Mexico right now. They have been decriminalized in places even including Washington, D.C., but that's not under a medical, type of umbrella.
Mm-hmm.
Like I was saying, there's been more liberalization of these medicines, and it just depends on what state you're living in.
Mm-hmm.
And really, ketamine is the only thing that is diversely and diffusely available at the moment.
Okay. Say my patient wants to approach somebody in the state of Delaware to participate in a program. Is that possible?
Yes, it is. And, it's very interesting where ketamine therapy has been going because, like I said, the overall background that I've been coming from is about really, one-on-one, a patient in a room, or even two therapists with one patient in a room sitting and creating this specific setting for them to undergo the treatment with. There are some places now that commonly do, ketamine therapy at home, where they will prescribe the medicine for the patient at home and give them specific instructions. And I was doubtful about that in the beginning, but I've spoken to some people who have actually said that it was helpful for them. So again, it's an emerging field. And I think that if you are just able to find people who are experienced, and you need to use your common sense if you feel comfortable, with where you're going. But there are many opportunities, including, like I said, in the Philadelphia area as well as in Delaware.
Interesting. You do need a certification if you want to dispense some of these medications?
So the truth is that there are no recognized certifications at the moment, except, you have to have a medical license to be able to prescribe them. So that is the certification that you have to prescribe ketamine at this time. But honestly, any doc could prescribe it. It's just that, most docs don't have experience with it, and you would really want to defer to someone who does. Mm-hmm. And most of these ketamine clinics, they do have psychologists who are affiliated with them, and they do thorough intakes of the patients before. And my recommendation is that you go to a place like that, where they're going to really do that whole, again, like I say, biopsychosocial approach to working with a patient.
Again, anything available in this area?
Yes, and again, you can go and look up. There are, I believe, like I said, 5 clinics in Delaware that I saw.
Okay. And you can look them up under psychedelic medication?
You can look under ketamine-assisted psychotherapy.
Just ketamine. They're not using psilocybin. They're not using mescaline. They're not using LSD at this point.
Correct. None of those are legal at this point, absolutely in the state of Delaware. And like I said, there's only a few states where psilocybin is legal. And then, like I said, there's this other aspect of it where there are certain churches and things where they've been used for hundreds and thousands of years, which is another.
They're spiritual.
That's right. It's very interesting because the Native American Church, which you mentioned in the U.S., they got approval through the Supreme Court. I think it was back in the 50s to use peyote as their sacrament, and that's continuing to be used. Also, ayahuasca, which is another medicine that is serotonergic, and the active ingredient is DMT, that there have been 3 ayahuasca churches that have been approved in the States. But, there's a lot of this type of use of psychedelics going on under the umbrella of what people are calling churches, but it's really not legal. And those things are all, even though there's some people may say that they have they're doing the medicines in the same way as the approved ayahuasca churches that went through the whole legal pathway, they're not really protected. And so you just have to be very cautious with who you get involved with.
Do you think the FDA is going to ever budge and make it more available?
You've asked that, and I do think that they will.
I'm asking again.
I do think that it's going to happen. It's just I've backed off on my expectations just again from watching what happened, from the beginning of the interest in this medicine with Michael Pollan's book that came out, in like 2018, which really was part of the explosion in interest. And then again last year where the FDA did not approve MDMA.
Okay.
I was recently at a conference up at Harvard Law School, where they were looking at all of the different, approaches toward legalizing these medicines. And, it's just really step by step. I do believe that down the line they're going to be taken out of Schedule 1, but to really say when that's going to happen, I don't know.
Interesting. Okay. Anything you want to ask me, or is there anything you want to add that we maybe skipped over or missed?
All that I want to say, it's something that we talked a bit about, but I believe that the potential for these medicines is tremendous. I think that it gives us another tool in our armamentarium, especially for mental health and maybe for other areas. Like I said, there's vast research going on right now from everything from fibromyalgia to head injury, as I was saying. So I think that the potential is there, and I think that it's a great breakthrough that the feds have eased up some, at least in allowing research into these medicines. And I think you're going to see a lot more openness to them in the next 5 or 10 years. There's a lot of pharmaceutical companies, working on, varieties of these medicines that are shorter acting, so that they're not requiring someone to be in a hospital situation or clinic situation where they have to be there for 8 or 10 hours, till their psychedelic treatment is done. And so there's a lot of interest in this, and I think you'll see a lot of movement in the future. I just can't predict exactly
when it's going to happen. Okay, if people are interested in finding out more about this, where do they go? Who do they call? Do they look it up? Do you got any biographical information that or information that they could look up and?
Sure. One is I think some very good resources. One is the MAPS, MAPS.com, and again, it might be .org, but MAPS is the Multidisciplinary Association of Psychedelic Studies. And MAPS is the one who is doing the research on MDMA, but their website has updates on the research of everything that's going on. There's also, through the University of California, Berkeley, there's a weekly email that comes out called the Microdose, and and anyone can sign up for that. And that also has a lot about all of the newest research and whatever's going on new in the psychedelic field that people can look toward. Here in Delaware, people, of course, are welcome to contact the ketamine clinics that are available, and I'm trying to think, like I said, right now I'm more involved in the program through the California Institute of Integral Studies, so I'm not actively using psychedelics in my practice. But I'm trying to think of what's the best way to connect people. But I think that really just talking to your primary care physician about what the opportunities are, or if they have any knowledge about these medicines, and also talking to their mental health professionals first, and through them that possibly they can make a contact.
Well, I'm hoping this podcast opens this up to some of the physicians that listen in, particularly primary care, because they see it a lot. I'm sure the psychiatrists and psychologists are aware of this because that's what they do. They work with these people, and they know what's out there to help them. I'm just hoping that we get the message out that there's potential here for some really, really good medicine, provided it's under good supervision and by those who know what they're doing.
Sure, and I'm happy to be in contact with any healthcare professionals or mental health care professionals who, if they need any insights on connections locally or nationally.
Well, they know how to get you. I've given your bio so they can call you and say, hey, what's up?
That's correct.
Okay. Anything else, Jeff?
No, I think that we've covered it nicely, and again, I just want people to keep an open mind. Like I said, as a pain management doctor, for me, it's been such a challenge to watch people suffer with chronic pain going through so many treatments, and the fact that these medicines are not, addictive, they're not something that's habituated. I feel that they do give, a different tool than the type of things that we've been using, and should be considered.
Well, I know that a restricted drug, THC, marijuana, has now been opened up in our state. It's recreational and medicinal. I have been using it for medicinal for years now, since it was approved for that. And I've seen some benefits in the patients that I've used it for, particularly in chronic pain. I've seen them come down or off of their opioids, which is what we're all trying to do.
Yes.
That's why I see the feedback from the FBA, the feds, in saying, well, we don't want to approve these, but they still got opioids out there, and they say, don't use opioids, but we have to have something to control people's pain, because pain is there, and it is real in many, many, many people. Some people can't get out of bed until they take their opioid. So I would think that would be an argument we could use for opening up the floodgates, so to speak.
Well, I think it is a good argument. And again, I think that like places like the VA, which there is more interest going on, at least nationally, is a good place for there to be some more research studies and things happening. Also, this administration that's currently in has an openness to psychedelics, and at multiple levels. So again, I think we may see some movement.
I hope it doesn't become a political issue and stays a medical issue. That's the most important thing, because once you say one side says this, the other side says that, and they don't want to agree. I say yes, you say no. The Beatles. This has been a very interesting discussion. I'm glad you could attend and give us the information we need to know. I learned a lot through my research. Is there, lastly, anything else you want to add?
I think that we've covered it.
Okay, very good. Well, out there in the audience, I'm sure you'll enjoy this podcast. It's been very informative, very educational, and any more information you need is all in the podcast. Just take a listen, copy it down, and go get it.
This has been Delaware Healthcare Reality, a podcast presentation of the Medical Society of Delaware. For more information about MSD, visit our website, medicalsocietyofdelaware.org. For questions or suggestions regarding our podcast, email us at healthcare.reality@medsocdel.org. Thanks to audionautics.com for our music. The executive producer of Delaware Healthcare Reality is Mark Thompson. Delaware Healthcare Reality is produced by Tom Mitten. For the Medical Society of Delaware, I'm Lori Ann Rhodes. Watch for our next podcast episode. Until then, be well. The Medical Society of Delaware, MSD, is providing this podcast for informational purposes only. It provides neither medical, legal, nor any other professional advice. The views, thoughts, and opinions expressed by the host or any guests are their own and do not reflect the views or policies of MSD. Unless specifically stated, reference to any specific product, service, or entity does not constitute an endorsement or recommendation by MSD. Reliance on the information provided in this podcast is exclusively at the risk of the listener. MSD expressly disclaims any and all liability or responsibility for any direct, indirect, incidental, or other damages arising out of any individual's use of, reference to, or reliance on this podcast or the information presented in this podcast.